In today's video, we are doing a head-to-toe approach of evaluating your cholesterol and how to lower cholesterol levels naturally. So let's dive in. Welcome to the channel. My name is Dr. Jessica. I am a naturopathic doctor and acupuncturist as well as a health coach. And online, I help clients optimize their health and wellness. So as I am focusing on optimizing health and wellness, something we have to look at is your lab work. And a lot of times we deep dive into cholesterol levels. Now, cholesterol levels rise for many different reasons, and I think that's an important part of the conversation. A lot of times with women, we'll see during menopause or perimenopause, your cholesterol levels, your lipids, your triglycerides start to rise up out of nowhere, even if you've changed absolutely nothing. For another large group of people, we often see those levels just kind of creep up incrementally year over year. So that's another reason why you need to make sure you're constantly getting your labs checked at least yearly. Now, first thing I'd like to talk about is cholesterol testing and how you need to get a really in-depth panel in order to actually know what is driving your levels of cholesterol. So one test that I absolutely love is called an NMR lipid panel. The reason why I love a deeper dive panel like this is because it's not all just about LDL-C. What we're seeing and what we're knowing now from more studies is that one of the big drivers of cholesterol and the associated risk of heart disease or cardiovascular disease is not only LDL-C, but more importantly, it's the LDL particle number and the size or density of these LDL particles, because those small and dense particles are the ones that are really driving a lot of the arteriosclerosis and increasing your risk of heart disease. What we really want to do is have this great breakdown so that we can know, is this part of a contributing factor? And this may also come up when you're having the discussion with your doctor about whether to go on a statin. That's a whole other video that we can do later, but these are some of the things you might want to look at first. Another great test is to do something like coronary calcium score. This will give you a lot of information about if there's already a lot of plaques being built up into the arteries, and again, will inform cardiovascular risks. So they often kind of go along with the lipid panel or with your cholesterol numbers. Another really important test I like to look at along with the cholesterol, and this is outside the NMR, is something like an ApoB. This ApoB number is going to give us, again, more information into actual particle number or how much of that LDL is actually floating around. So the ApoB actually kind of carries around the LDL and the VLDL. It gives us another estimate of risk factors as well. So this is another great add-on that a lot of times doctors just are typically not ordering. Another test that I like to order along with that lipid panel is an hs-CRP. Now this is generally a test for inflammation and also more specific for the cardiovascular system, and will give you a risk, kind of a number or a range that tells you how likely are you to have a cardiac event in the future. So quick review, and I do have a more in-depth video about the NMR panel, but NMR panel I love for testing along with the insulin resistance, the ApoB, a coronary calcium score, and a hs-CRP are really kind of bigger picture of what is going on with cholesterol levels and how much cardiovascular risk you are at. Now that we know what we're looking at, we can talk more specifically about how do we actually start to bring these levels down. And of course, this is where nutrition is going to play a huge factor. We want to make sure we're eating enough vegetables and leafy greens, things that are going to give us a lot of fiber, because fiber is going to help bind excess cholesterol and help it be expelled. So things like avocados, nuts and seeds, so your fatty fish, things like your sardines or your mackerels, and even adding in things like olive oil. Those are all going to have your healthy omega-3 fatty acids, which are great for maintaining healthy cholesterol levels. So your nutrition is really important here. And we just want to, again, my approach is always to focus on whole foods. The more we can leave the processed foods alone, the better off we're going to be. I always recommend having like 2 cups of vegetables with each meal. Yes, I mean, also breakfast, because most Americans are not getting enough. Another aspect that will come as no surprise is exercise. We want to make sure you're walking. Even just walking 10 to 15 minutes after your meals can be very helpful. That also helps with the glucose levels, which do tend to an insulin resistance, which also have an interplay. When we push into insulin resistance, that can also start to increase our cholesterol levels and our LDL particle numbers and the really more dangerous aspects of high cholesterol. When it comes to exercise, you also want to be resistance training, especially, again, I see a lot of women, so I'm always going to emphasize, or women after menopause or approaching menopause, and as we age, the more lean muscle mass we are able to carry, the better quality of life we're going to have, the better we're going to respond to glucose, the easier it is to maintain our cholesterol levels. And also, it's one of the biggest driving factors for quality of life as we continue to age. And if we're optimizing health, we got to be optimizing our lean muscle mass. So resistance training 2 to 3 times a week, for me, non-negotiable. And of course, the thing most people are always interested in are the supplements. What are, and I won't say alternatives to statins, but this is a conversation to have with your doctor to properly assess your cardiovascular risk. And then you can make an informed decision about what type of treatment is right with you, along with working with your practitioner. So disclaimer is out of the way. Now, there are a number of options here, and a lot of them are depending on what you're targeting in the cholesterol panel. Are you targeting triglycerides? Are you targeting ldl-c? Are you trying to target particle number or particle size? Or are you trying to raise HDL, the quote unquote good cholesterol? So knowing what you're actually looking for is going to help guide you as far as which supplements you may want to choose here. And this is more of a nuanced conversation, but these are kind of my top shelf things that I go to in clinical practice. So number one is berberine. Berberine is great not only for lowering LDL, it's also great for helping you maintain healthy blood sugar or healthy glucose balance, or kind of insulin resistance or insulin sensitivity, I should say. And again, that can also play a role in our lipid panel looking a bit off. So adding something in like berberine can be great because it can hit both of those aspects, both the glucose regulation as well as the LDL. Another supplement that I regularly go to is bergamot, and this also can help to lower the LDL and also bring up the HDL, or the good cholesterol, and also can help to lower triglycerides. So this really packs quite the punch when looking at that lipid profile. And not a lot of people tend to know about this one, but there's a lot more research. I will leave links to a number of articles down in the description box if you like to kind of peruse through the literature there as well. Another option that I like is Nattokinase. Is actually derived from natto, which is the fermented soybean that's pretty popular in Japan. The extract with the Nattokinase has been shown to really help improve lipid levels, as well as has some effects on lowering hypertension as well. So if, part of your cardiovascular risk may be that you are hypertensive, this is one that I will use with patients as well when we're trying to pull them off of their hypertensive meds and get them, as we're doing the lifestyle and the diet, don't forget, try to get those numbers regulated. And this has been one that has been helpful for me with working with different patients. Again, I am not telling you to go off of your medication, so do not do that. Talk to your doctor. I am just letting you know some options that I have worked with and things you may want to have a discussion about or may want to consider for yourself. I'm here to empower you and to help educate you, because a lot of people don't have either a naturopath in their area or don't have someone experienced with working with these types of things clinically. So I'm here to educate and to empower you, but you have to have these conversations with your provider, okay? Just to be clear. Another top shelf recommendation, and this one is probably more common, and that is red yeast rice. Red yeast rice actually works on the same mechanism that a statin does in reducing the HMA-CoA reductase, which basically is reducing the amount of cholesterol the body is producing. So in doing that, then cholesterol levels comes down, and is again one that I've seen be helpful. And of course, there are a number of other supplements out there that can be helpful with this approach, but these are just kind of my top tier or my go-tos. Again, it's always going to depend on the particular patient in front of me. Now, in saying all of this, I do want to emphasize the fact that it's not just about the supplements. It's not just about nutrition. It's not just about the exercise. It's this combination together. And my approach is always to use any medications or any supplements as a bridge as you're working on the diet and the lifestyle and the stress reduction and the stress relief as well. Now, the mental aspect is something we should talk about because a lot of times there's a stress component that happens as well. Because when you are really stressed out, there's a lot of cortisol being produced. Cortisol then affects those lipid levels, and we can see that rise in our lipid panel when that happens as well. So making sure that you have some approaches to work with stress reduction or stress mitigation or stress management, whatever you want to call it, things like your meditation, your mindfulness, your journaling, your breath work, all are really important, really crucial so that we can kind of downregulate that chronic cortisol production. And again, this is all part of a head to toe approach. So I hope that this was helpful. This is something that I do for my clients, help them work through these diet and lifestyle changes. So if this is something that you need help with, please feel free to click on the link in the description box. You can learn how to work with me. I can help you work through these dietary lifestyle type of changes in a systematic way that's not too overwhelming. So I hope that this was helpful, and I will see you in the next video. Bye.